Hi everyone, my name is Catherine and I'm going to present the case study of hydrocortisone cream to reduce perineal pain after vaginal birth, a randomized trial. So this is a significant problem because the majority of our postpartum patients that have a vaginal birth actually report having some sort of perineal pain. This could be due to tissue damage that occurred during the childbirth, inflammation from the second stage of pushing, or they have an episiotomy, which is a surgical incision that is made during childbirth in the perineum. So, for the most part, the majorities of these postpartum patients do require some sort of pain management. Some ways that they would describe this pain would be as aching, throbbing, tenderness, stinging, or they just feel uncomfortable. But there are medical interventions that can be done to help relieve the pain. Examples that would be oral anxiolytic medications such as ibuprofen, topical anxiolytic creams, or the use of cold or heat therapy. Example, cold therapy would be as ice packs, and in heat therapy, they would actually just fill up a tub with some lukewarm soapy water, and it could just sit in it. So this is significant to our nursing practice as nurses because as nurses, we want to provide quality of care to our patients. And one of the ways that we do that is through pain management. So especially with our postpartum patients, it's crucial that we give them the ability to alleviate their pain, especially when it comes to postnatal care. Even though if this pain is described as mild, it's still important that they get options to help alleviate this pain because by helping to improve their pain management, we improve their quality of life, which means that we as nurses are providing them quality of care. So the purpose of this study was they wanted to determine if the use of the hydrocortisone cream will actually decrease the perineal pain in the immediate postpartum period. Now, I do want to make a note that there was no stated research question in this study. With the theoretical framework, the researchers want to test out this theory that they came up with the hydrocortisone cream. So at their facility, they noticed that the doctors in the postpartum unit were putting in drug orders for the use of hydrocortisone cream for patients that were experiencing perineal pain after they had a vaginal birth. So they had this theory to see, can the hydrocortisone cream reduce the perineal pain in our postpartum patients after having a vaginal birth? Now, I do want to make a note that they are aware that hydrocortisone cream does have anti-inflammatory properties, so it does help to decrease the inflammation that occurs in the perineum after birth. But for the purpose of this study, they just wanted to measure the pain level and see if there's any reduction of it if they use hydrocortisone cream. So with the protection of patients' rights in the actual study, no names or information was revealed in the actual study to reveal the identity of these participants, but also at this healthcare facility, in their health system, their institutional review board actually took a look at the study and approved of it to be completed. So with our research design, it was a randomized controlled trial where each participant served as their own control. And how they did the randomization of this trial was by a computer generated number sequencer. So each participant received 3 different types of pain management, either hydrocortisone cream, a placebo cream, or no cream at all. So the no cream application was actually the control part of the study. And then each participant received about 1 to 3 sequential times in the first 12 and a half hours after birth. So with the population and sample that was done, it consisted of 26 participants of a convenient sample, which means everyone that was in the sample just was at this one facility. And then these participants had to have a vaginal birth and be medically stable. They also had to have some sort of perineal laceration or episiotomy done. And they also had to have no known hypersensitivity to the hydrocortisone or witch hazel, because when they applied the cream applications, they put it on a cotton pad that had witch hazel on it. So the setting of this study was at Lutheran Medical Center in Wheat Ridge, Colorado. This is a non-for-profit hospital. It served mostly a predominantly Caucasian middle-class community, and then the size of their unit was about 40 beds. So the interventions they had was 3 different methods for pain management. So they used the hydrocortisone cream, the placebo cream, and they had a no cream application. So the independent variable was the use of hydrocortisone cream or the placebo cream after vaginal birth, and then the dependent variable was what was the change in the perineal pain levels immediately before or about 30 to 60 minutes after the application of a topical cream or no cream application. So the way they collected this data was through a visual analog scale. So I have an example of that on our slide here. At one end it says no pain at all, and the other end says the worst pain imaginable, and this is ranged from 0 to 100 millimeters. So how they collected the data was when the participants were admitted to their postpartum unit, within 2 hours, a researcher would come in and ask them, can you rate your pain level on this pain scale for us? And once the participant rated their pain, that's when they did the pain management and did the cream application or no cream application. Then they waited about 30 to 60 minutes and asked them to rate their pain again. And that's how they collected the data. So with their findings, before the treatment applications, the levels of pain range from about 0 to 82 millimeters. So the average was about 21.9 to 22.9 millimeters, which is what they expected, with perineal pain is usually described as mild or moderate pain. But after treatment, they actually found that with both the hydrocortisone and placebo cream, they found a reduction in pain with both of those creams. So the average change in the hydrocortisone cream was about negative 4.8 to 8.4 millimeters, and then with the placebo cream, the change was about 6.7 to 13 millimeters. And then with the no cream applications, they found the changes in pain scores was about 1.2 to 10.5 millimeters. Now, there was some limitations with this study. They only evaluated one type of hydrocortisone cream and placebo cream. Pain reduction was only evaluated after the first day of birth. And then these patients had to have some type of perineal laceration, and only one patient in the study had a episiotomy. So for implication of practice, they did find that there was pain reduction with both use of creams compared to the no cream application, but there was no real difference between the hydrocortisone cream and the placebo cream when it came to pain reduction. What they could think, this could just be related to these creams are just providing a soothing effect, and it just adds moisture to the area, and by doing that it makes a protective barrier to help irritation due to possible friction. But I also want to make a note, there are no previous studies that have evaluated hydrocortisone cream alone as method for treating the perineal pain. So in conclusion, both the hydrocortisone cream and placebo cream help to reduce the pain levels in postpartum patients after having a vaginal birth. So that's great. That's another less non-invasive pain management for these postpartum patients. But I do believe that we need to have further studies done. Maybe we need to see, are there different types of hydrocorticoids, or is one more effective than the other? Can we make the population a little bit more diverse? The setting was in a primary Caucasian middle class community. I would like to see this study was done maybe like in the inner city, like of New York City or Chicago. And then, but also could we actually maybe have also have a diverse population that have more episiotomies? Could they find pain relief with the use of hydrocortisone cream? But overall, I do think the study was quite effective and definitely gave some insight of the use of hydrocortisone creams to help to reduce pain levels for postpartum patients. And that concludes my study. And this is my reference, and I hope you all have a good rest of your day. Thanks.